Hi, my name's David Rodricks. I'm a board-certified orthopedic surgeon at Ocean Medical Center. The reason I went into the medical field is that for some reason I've always had a desire to do medicine. My father is an anesthesiologist, so I always had an interest in it. And then I kind of fell into orthopedics, fell in love with it. I was really fascinated by the surgeries, the recovery, how much you could really help patients and make a difference in the quality of their life. One of the really big topics with orthopedic surgery and with specifically what I do, which is hip and knee replacements, is the anterior hip replacement. That's a relatively new procedure in popularity. It's been around for 20 to 30 years, but it's a way of doing hip replacements that gives patients a much faster recovery. Instead of recovering gradually over 6 to 8 weeks or 10 to 12 weeks, a lot of people with the anterior approach actually recover and are back to work in 2 to 3 weeks. So it really cuts rehabilitation time down. The advantage of the anterior approach is instead of going through the muscles on the side of the hip or the back of the hip, that we actually go in between the muscles in the front. And that allows us just to go right down into the hip, do a beautiful hip replacement for people, and then since the muscles haven't been as violated as much, people are much stronger and recover a lot faster with a lot less pain. One of the most common questions I get is, when am I ready for a hip replacement, or do I need a hip replacement? And what I tell patients is pretty much always the same thing, is that number one, you'll know when you're ready. Number two, you always want to maximize conservative care. It's an elective procedure, and there's always risk with the procedure, whether you do it from the anterior approach or posterior approach, and so you have to keep that in mind. The most common time that people really come in to see me, they have pretty big complaints that nothing's helping them. They're limping, they're unable to get their shoes and socks on, they can't cross their legs, they have night pain, thigh pain. It can even extend all the way down into the knee. And so they'll come in with a mixture of those complaints, and that's usually definitely when I'll say that they're a candidate for a hip replacement. And the nice thing about it really changes somebody's life. So you do a hip replacement on somebody that's really not able to do things and really restricted because of their hip, you can actually give them their life back. So the quality of life becomes better, they become happier, they can do more. The patients that would qualify for either the anterior or posterior hip replacements, they do vary. So the anterior hip replacement, we're a little stricter on who we pick for that. I would typically say a person with a body mass index of 30 or below, or somebody that does not have truly substantial bone loss in their hip. The reason I do joint replacements is that I love helping people. I mean, they're my favorite patients in the world, because you really take somebody that's having a lot of difficulty, and they've had difficulty for years and it's been getting worse, and you can offer them something after the conservative management has failed that will give them their life back. People come to me and do their replacement. Within a few months, they're up, hopefully running around, but at least walking around again. But, I'll get cards and thank you cards. I've kept every one I've ever gotten in my life. But it really means a lot to me when people email me or, send me a card and say, you know what, I walked on the beach for the first time in 5 years. I never thought I could do that again. Or I'm back walking with my grandkids and I can hold them again without worrying about falling down because my hip or knee is going to give out. So just helping people change such a big part of their life and give them their life back and make things more enjoyable for them, and that makes all the difference for me. And